Blood pressure is often called the silent killer because high blood pressure, or hypertension, typically has no symptoms until it causes serious problems like heart attack, stroke, or kidney disease. For older adults, the stakes are even higher, but the good news is that with proper knowledge and management, we can significantly reduce these risks. Before we dive in, I want to remind you that while this video provides comprehensive educational information, it should never replace personalized medical advice from your healthcare provider. Every person is unique, and what works for one individual may not be appropriate for another. Section 1. Understanding blood pressure basics, 3 to 10. Let's start with the fundamentals. What exactly is blood pressure, and why does it matter so much? Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps blood throughout your body. Think of your circulatory system like a garden hose. The water flowing through represents your blood, and the pressure that water exerts on the hose walls is similar to your blood pressure. When we measure blood pressure, we get two numbers. The top number is called systolic pressure, which measures the pressure in your arteries when your heart beats and pushes blood out. The bottom number is diastolic pressure, which measures the pressure in your arteries when your heart rests between beats. For example, if your reading is 120/80, written as 120/80 millimeters of mercury, the 120 is your systolic pressure, and the 80 is your diastolic pressure. The millimeters of mercury stands for millimeters of mercury, which is the unit used to measure pressure. Why does this matter? When blood pressure is too high, it puts extra strain on your arteries and your heart. Over time, this can damage the delicate lining of your blood vessels, making them stiff and narrow. This damage increases your risk for heart disease, stroke, kidney disease, vision problems, and even cognitive decline. On the flip side, blood pressure that's too low can also be problematic, especially for older adults. Low blood pressure can cause dizziness, falls, fainting, and in severe cases, inadequate blood flow to vital organs. Section 2. How blood pressure changes with age, 10 to 18. As we age, our cardiovascular system undergoes significant changes, and understanding these changes is crucial for managing blood pressure effectively. One of the most important changes is that our arteries become stiffer and less elastic. This happens because over decades, the walls of our arteries gradually thicken and lose some of their ability to expand and contract. Think of it like a rubber band that's been used for years. It doesn't stretch as easily as it once did. This arterial stiffness has a direct impact on blood pressure. When arteries are stiff, the heart has to work harder to push blood through the circulatory system, which typically causes systolic pressure to rise. This is why it's quite common to see systolic blood pressure increase with age, even in people who are otherwise healthy. At the same time, diastolic pressure often stays the same, or even decreases in older adults. This creates what we call a wider pulse pressure, which is the difference between the systolic and diastolic numbers. A wider pulse pressure can be a marker of arterial stiffness and cardiovascular risk. Another age-related change involves the baroreceptors, which are specialized sensors in your blood vessels that help regulate blood pressure. These sensors detect changes in blood pressure and signal your body to make adjustments. As we age, these baroreceptors become less sensitive, making it harder for the body to quickly adjust blood pressure in response to changes in position or activity. This is one reason why older adults are more prone to orthostatic hypotension, which is a sudden drop in blood pressure when standing up. You might have experienced this as a feeling of dizziness or lightheadedness when you get up too quickly from a chair or bed. The kidneys also play an important role in blood pressure regulation, and kidney function typically declines
This is when the top number is high but the bottom number is normal or even low. This pattern reflects arterial stiffness and presents a treatment challenge. We want to lower the high systolic pressure, but we need to be careful not to drop the diastolic pressure too much, which could reduce blood flow to vital organs. Life expectancy and personal goals also matter tremendously. For a healthy, active 65-year-old with a life expectancy of 20 or more years, aggressive blood pressure control to prevent future cardiovascular events makes sense. For a 90-year-old with multiple serious health conditions and limited life expectancy, the calculus is different. Quality of life and avoiding medication side effects may take priority. Section 5, the optimal blood pressure range, 38:00-46:00. So, what is the best blood pressure for older adults? Based on current evidence and expert consensus, here's what we can say. For generally healthy older adults without significant frailty, limited life expectancy, or high fall risk, a target blood pressure of less than 130/80 is reasonable and supported by strong evidence. This target has been shown to reduce cardiovascular events and mortality. For older adults with some degree of frailty, multiple chronic conditions, or high fall risk, a more moderate target of 130 to 140 systolic and less than 90 diastolic may be more appropriate. This still provides cardiovascular protection while minimizing the risks associated with very low blood pressure. For very frail older adults, those with limited life expectancy, or those experiencing significant side effects from treatment, a target of less than 150/90 may be acceptable, focusing on quality of life and avoiding harm. It's important to note that these ranges are starting points for discussion between patients and healthcare providers. The optimal target for any individual depends on a comprehensive assessment that considers overall health, medications, fall risk, cognitive function, kidney, cooking at home more often, and using herbs and spices instead of salt can all help reduce sodium intake. The blood pressure lowering effect of sodium reduction can be quite significant, often comparable to taking a single blood pressure medication. Potassium is another important mineral. Adequate potassium intake helps counter the effects of sodium and can lower blood pressure. Good sources include bananas, oranges, potatoes, tomatoes, spinach, beans, and yogurt. However, people with kidney disease need to be careful about potassium intake and should consult their healthcare provider. Weight management is crucial. Even modest weight loss of 5 to 10 pounds can significantly lower blood pressure in people who are overweight. However, unintended weight loss in older adults can also be a concern and may indicate underlying health problems, so weight management should always be discussed with a healthcare provider. Physical activity is one of the most powerful lifestyle interventions for blood pressure. Regular aerobic exercise can lower systolic blood pressure by 5 to 8 points. The recommendation is at least 150 minutes of moderate intensity aerobic activity per week, which could be 30 minutes on most days. For older adults, good options include brisk walking, swimming, water aerobics, cycling, or dancing. Resistance training is also beneficial and helps maintain muscle mass and bone density. The key is finding activities you enjoy and can sustain over time. Always check with your healthcare provider before starting a new exercise program. Limiting alcohol is important, as excessive drinking can raise blood pressure. If you drink alcohol, the recommendation is no more than 1 drink per day for women and 2 for men. Stress management shouldn't be overlooked. Chronic stress can contribute to high blood pressure. Techniques like deep breathing, meditation, yoga, tai chi, or simply engaging in enjoyable hobbies can help manage stress. Sleep quality affects blood pressure regulation. Poor sleep or sleep disorders like sleep apnea can raise blood pressure. Aiming for 7 to 9 hours of quality sleep per night and addressing sleep problems with your healthcare provider is important. Smoking cessation is critical. If you smoke, quitting is one of the best things you can do for your cardiovascular health. Smoking damages blood vessels and significantly increases cardiovascular risk. As we wrap up this comprehensive look at blood pressure in older adults, let's review the key takeaways. Blood pressure management in older adults is not one size fits all. The optimal target depends on your overall health, frailty status, other medical conditions, fall risk, and personal goals. For generally healthy older adults, a target of less than 130/80 is supported by strong evidence. For those with frailty or other complicating factors, higher targets may be more appropriate. Lifestyle modifications including diet, exercise, weight management, sodium reduction, and stress management are foundational and remarkably effective. Regular monitoring, whether at home or in your doctor's office, is essential for guiding treatment. The conversation about blood pressure targets should be collaborative between you and your healthcare provider, taking into account your unique circumstances. Remember, the goal of blood pressure management isn't just to achieve a number, it's to help you live longer, healthier, and maintain your independence and quality of life. Thank you so much for watching this entire video. I hope it's provided you with valuable information to guide your conversations with your healthcare provider. If you found this helpful, please like this video and subscribe for more health content. Take care of your health, and I'll see you in the next video.